Good afternoon. It's Thursday. It's 3:08 and it's time for you to be adrenalized. That's right, folks. It's time to get that blood flowing and get re-energized. Why? Because you're here. You're alive and it's time to be motivated to live your best life. Hello, everyone. Welcome to the Tom Marino Show. I am your host, Mindset and Success Strategy Coach Tom Marino. Thank you so much for tuning in today on this beautiful Thursday. I say this every single week. It's a beautiful Thursday out there, and it is beautiful, and it's fall is in the air. It is sweater weather. So it is time for you to get out all of those winter garbs and get those sweaters on and start enjoying this beautiful season of transition, right? That's what we're in. We're in a season of transition where we get to experience the beauty that comes from stuff even dying, which is really such a refreshing transformation that takes place in our world, especially when you look at the trees. It's that beauty of the leaves changing, and it's just a reminder how we can all change, and everybody is capable of change. So just look at that as your season of transition as we go into the fall here and almost the end of October. I can't believe that. Halloween's in 10 days, which is going to be a lot of fun. Can't wait for Halloween. It's one of my favorite holidays. But listen, we have a great show for you in store today. I am so excited. I have two very special guests with me. They are Aynisa Leonardo and Stephanie Morgan, and they are in business development at Wellbridge Addiction Treatment and Research Center in Calverton. Aynisa is actually a host of a show here on LI News Radio on Wednesdays from 3 to 4 and Sundays from 5 to 6. The name of the show is called A New Way. So I want to welcome both of you. I'm so excited to talk to both of you today.
Thank you so much,
Thanks
Tom.
for having us.
This is awesome. We're going to do a show swap. I've been show swapping the last couple of weeks. Last week I had Lisa Fine on from the You'll Be Fine show.
Nice.
Now I have you guys on from Wellbridge. So I'm just so excited to talk with you guys because I had such a great time when I came to visit Wellbridge. It is a beautiful place.
Thank you.
Thanks so much.
Can you tell my listeners, because we have all different listeners, and I repurposed this as a podcast, but tell what is Wellbridge about? So who wants to go first?
Steph, take it away.
Steph, you do your BD thing.
Sure. I will tell you about Wellbridge. So we are an inpatient detox and residential rehab center. And while that might not sound fun to talk about, the things that we're doing on our campus, the innovations that we are implementing to change the game of addiction treatment is truly exciting. Mm-hmm. And I've been there about 7 months. I've been working with Aynisa the entire time, and I'm learning so much as I go, but it's empowering to be in a position where we're helping people every day, especially during a time where so much help is needed. So I'll turn it over to Aynisa to talk more about the details of what's going on our campus.
Yeah, and I'll keep it brief for now, but the reason why we're so excited to talk about Wellbridge is because we really have a new approach to looking at treatment and recovery. It's something that we consider exciting. We want any patients that call us to feel excited about entering into this journey, even though they're coming from a state of crisis. So we offer a treatment experience that's a little bit different than what they might feel. And we hear that all the time. Patients come in and right in the front lobby, they're like, wow, this place is different. And we do that through the campus, the environment, the services we provide, and some of the amenities we have, and the combination of those things.
Yeah, I mean, I felt that the minute that I walked in, right? Like I was there to visit you guys and to meet with you and talk about some things and how we can collaborate and things like that. And the second I walked in, I felt a peace. I felt a presence, like an essence of healing already start, right?
That's great to hear, yeah.
And you just walk in and it's like, because listen, getting people to commit to rehab, getting people to go through the process, it's not an easy thing. Obviously, we know this, and we know with the holidays coming up and everything that people are often triggered by the holidays. And this is going to be a time, obviously, where you will be busy, unfortunately, but fortunately, you will be busy to help people get through these tough times. But the healing essence from the minute you walk in is just amazing.
It's great to hear, really.
What do you think it is about your facility that brings that about? Like, because it is the people. There's definitely I met amazing people in your place, like, and it's like, I want to work here, and this is thank you. But it's just like, what do you think it is about the environment in general that's different?
Well, I'm so happy you picked up on that, and it's intentional. The design of our campus is we want you to feel that as soon as you walk in the door. Everything was designed with that intention to have this dignified feeling that there is hope on the other side. We are intentional about who we staff at Wellbridge. They need to embrace our mission, which is to help every single person that walks through that door find lasting recovery. And those pathways to find that recovery are different for every person.
Right.
And so it's not going to be a one size fits all, and you have to embrace that to work there. And so those people you met, they're there for a reason, and we are ready for the holiday madness that will ensue. We're prepared, and our doors are open.
Yeah, and that's amazing. You have how many beds available at Wellbridge again? It was one.
We have 120.
Right. Yeah. That's what I thought. 120 total. That's incredible.
Yeah.
And, so there is capacity.
Absolutely.
And there's opportunity if somebody's really struggling. And really, I mean, you walk in and you think it's a spa. And
I think we want it to be an intense experience as far as like clinical services, medical services, right? So they're getting that care, but in something that feels like a retreat.
Right. Well, I was so impressed with the art services, the pottery. I mean, we saw the kiln. I mean, you have pottery classes, you have yoga, you have a beautiful gym and a beautiful facility and a pool. Like, you bring all of those pieces in, but those are all ways people heal and come to a place of calm. They're all parasympathetic nervous system stimulants in many ways, right? Because it's the thing that calms you down and it grounds you. So, right. I mean, what is one of the biggest things that you see for people who have gone through the facility that if they've had prior experience at a rehab?
One of the things that stands out to people that come through, I think the self-care that they leave with. So they're leaving, and we'll talk about a discharge plan, and we talk about what's needed as far as outpatient care and maybe seeing a psychiatrist and a therapist and support groups. But then they're talking also about, I want to go to a gym. I want to find a yoga studio. Right. I need to have a different nutrition plan.
Right.
And these are things, I've been in the field about 15 years. It's new to me to hear patients speak so openly about that on discharge. And it's nice to see they're prioritizing it. And I think that's because we prioritize it.
Right. And that is such an incredible part of the healing process, is prioritizing self-care. I mean, we're in the self-care business. You and I, we're promoters of that. And it's really, it is what starts the healing. So we're going to take a commercial break. And I'm telling you, we're going to have a great show. If you'd like to call in and you have a question for Wellbridge, for me, 631-451-1039. That's 631-451-1039. And again, this is Tom Marino and the Tom Marino Show. And I look forward to talking to you and speaking with Aynisa and Stephanie a little bit more after this break. Hey, this is Tom Marino of the Tom Marino Show here. Imagine you wake up and you've had a major sewer backup in your home. Well, let me tell you about a company that I've worked with personally, New House Restoration, where they take your damaged old house and make it a new house. For any water, fire, mold, or asbestos damage, please call them at 631-604-8590. That's 631-604-8590. New House Restoration. Are you tired of nosebleed seats and extra fees? Do you want premium seats at affordable prices? Hey, this is Tom Marino from the Tom Marino Show, and I want to tell you about the best way to get premium tickets at affordable prices for your next concert, sporting event, comedy show, Broadway show. And if you need them anywhere in the United States, just contact Ticket Time. That's TicketTimeUSA.com, TicketTimeUSA.com, and tell them that Tom Marino sent you. And welcome back to the Tom Marino Show. I'm your host, Mindset and Success Strategy Coach Tom Marino. Thank you again for tuning back in on this beautiful Thursday, October the 20th. I cannot believe we are in the 20th of October already. But listen, it is beautiful out there, and it's a beautiful time of year. And October is also Mental Health Awareness Screening Month. So, and depression screening. This is a big month for, in addition to being Breast Cancer Awareness Month, it's a big month for mental health and mental health screening. So if you have, if you've been struggling a little bit, and as we go through periods of transition, we tend to struggle, our mood tends to change. So if you're experiencing any additional stress, depression, depression or anxiety, get over to your primary care doctor. Ask them to do a PHQ-9, which is a fancy depression screening test, which is really a patient health questionnaire. I encourage everybody to take one. And it's also the generalized anxiety tool that the GAD-7 that can screen for people who have generalized anxiety. And, you never know. You may think that something's going on and it doesn't just feel right and you don't know what it is. And it could be some mild form of depression, form of anxiety. And if that's the case, let's get you to help. I always say, if it requires taking medication, it's like anything else in life. If you have high blood pressure, your body needs help getting that lower. If you are feeling down and you're having some emotional stuff and you're feeling like you want to be picked up, sometimes you need a little bit of help, and some medication is good for that too. That's my clinical hat going on there, people. That's the PA in me. But, we're talking today to Aynisa Leonardo and Stephanie Morgan from Wellbridge. And Wellbridge is out in Calverton, and it's a wonderful addiction treatment and research facility. And we were talking about all of the beautiful amenities that are available and all the different programs. And, Aynisa, when I came to visit you guys, we got into this incredible conversation on trauma, because you and I both are very much trauma-informed care clinicians.
Yes.
We believe in helping people and assuming and looking at everyone as having experienced trauma. And you said something about trauma that stuck with me, about normalizing trauma. So can we talk a little bit about how you help a lot of the people that come for rehab around dealing with their trauma?
Yeah, so we offer individual trauma therapy. Rapid resolution therapy is the method we use. And then we also do groups on trauma. That's the thing that kind of people notice. They're like, oh, what do you mean you do a group on trauma, right? So that's what we were talking about, Tom, when you came. We position it educationally, and it opens a lot of doors. So that's how we normalize it. We talk about, trauma is loss. Trauma is car accidents. Trauma can be anything that disrupts the development of your life, whether it's as a child or as an adult. And when we start talking about examples, exposure to natural disasters, being relocated from a home unexpectedly, 9/11. I mean, we as a community have experienced so many things over the years. We start talking about that. People are like, oh, actually, yeah, there was something that really affected me. And then the doors are opened.
Right. And trauma is such a critical part of understanding somebody's need for healing, right? Because if you can get to the core of what that issue is, you can really build from there. And unfortunately, we see trauma lead to so many addictive behaviors because it's a comfort, because it's an escape. Stephanie, if you had any experience, do you get to interact with the clients that are at the rehab facility? Do you have any experience with that?
Sure. So our business development team, we're very hands-on, and we work with our patients getting them admitted. That's the number one, most of the times where I'm meeting them is through that process. And then when I'm on campus, I like to sit in on some of the groups and workshops that are going on. And while I might not be engaging with them because I don't want to be disruptive, I do look around and I love to see the engagement. You can see the light bulbs going on. You can see the spark, the understanding. And education is a huge component of what we do.
Right.
We're learning every day. We want our patients to understand, like you said, normalizing. We can talk about these things. If you normalize it, they're not going to have this feeling of I'm different, and then they're internalizing that. So sitting in on those groups and just watching them really engage in the treatment that we're providing is so rewarding.
Yeah, I mean, you just hit on a very key point, right? So many people feel isolated and alone. Whatever you're going through, whether it's depression, anxiety, addiction, it's isolating, and you feel that isolation. So how do you help someone to break down some of those barriers to feeling isolated?
Yeah, I like I think the intro that you have, the analysis paralysis.
Yep.
We find that right from the initial call. I have someone I'm working with right now who's overanalyzing just the idea of coming into treatment. And it's stopping him from making that decision. And he's been in that state probably for months, honestly. He's working with a psychiatrist, and it sounds like he's been stuck.
Right.
People come in, they remain stuck in different ways, and they remain isolated, even if they're not physically isolated, meaning they could be in a room full of people, but be withdrawn.
Right.
Right. So a lot of the services that we do have that group element to it. I'm going to give one example, but there's probably 20 I could talk about.
Right.
We do drum circles.
Okay.
So people get together, we give them these really cool looking drums, and they do a tribal drum circle for 40 minutes, and then they talk about it. it's a nonverbal process, but at the end of it, they're outside, peers are hanging out, they're taking walks together, they're chatting. And before that, they might have all come in with their heads down, walking by themselves. So just that community-based setting that we have really supports really group recovery, group healing, right? And that's what it's all about.
Yeah, I mean, that is amazing that comes out of that experience, right? Because there's nothing like music or energy of music to move people to a different state,
100%.
to a different level of consciousness, right? I mean, it's just insane. Yeah. Now, the other thing I was so taken with when I was visiting was the family rooms that you have and how you do that. So how do you work with families to help their loved one?
So our family program is, from Wellbridge's inception, has been really the program that we've been elevating, and I think sets us apart. We provide therapy sessions at least once a week to families that where their loved ones are going through treatment. That support from family is so important to long-lasting recovery. If you have support and, understanding comes with time, I wouldn't say acceptance, but giving them the coping skills and the skills to understand that this is going to be a journey for their loved one for, a long time is so important. And it just really assists in the recovery process for our patients.
Yeah.
If I can give like an outside the box example too of what Stephanie's talking about, there's a woman we have still in our care who did not have identified family members as part of her support system. She was kind of estranged from her family. They weren't really as hands-on. She had been in multiple times to different centers. So she had a few friends that were helping her. So we did an intervention, a formal intervention with an interventionist and a group of her friends while she was in treatment to support her continuing care after rehab. But the fact that we did it as part of our family services, right? We consider that a family service. Right. But it was a group of long-term friends that she had that were really on board with helping her, and we were able to coordinate that.
Wow, that's wonderful. And is she still in treatment or she's out of treatment?
She was maybe leaving this week.
Okay, fantastic. Well, that'll be an incredible journey to see. Now, what is that post-stay journey like for people?
After they leave?
Yeah.
Everyone has an aftercare plan. Every aftercare plan looks different, as it should. So it could be outpatient. It could be a sober living environment that's really structured and like a higher level, or it could be someone who goes to outpatient once a week, 3 times a week. It really depends on what they need.
That's awesome. That family, having that support, whether it's friends or family or blood, right? I mean, as long as you have that, do you see a rate of return? Like, do people come back that don't have those good support structures? Do you see the support system being critical to the success of that person's sobriety? We're
not correlating that definitively. I would say I'm not sure about the pattern. But I mean, we see people return, unfortunately. I just don't know how well it's correlated with the support system. I'm going to say, just as a clinician, I feel like people that have supportive environments obviously have better outcomes. Yeah. But I'm not going to pretend I have data on that.
I mean, listen, there may be data out there somewhere,
I'm sure
but
there is.
We all know as clinicians, when you have the right support systems, people do better. Yeah. They adhere to their treatment plan better. They adhere to their whole care plan better. That's why we look for supportive environments.
And if they fall, the interventions happen sooner. Right. So if a relapse occurs, then it's like, okay, well, it's captured before 8 months goes by.
Yeah. We're going to have to take another break, but we will come back after these commercial breaks. Again, we're speaking with Aynisa Leonardo and Stephanie Morgan from Wellbridge Addiction Treatment and Research. You can find their website at wellbridge.org. That's wellbridge.org. And come back after the commercial breaks and give us a call if you have a question. We'll tell you the number right after these commercial breaks, but stay tuned.
Like that's what you want to do. Here come bad news, talking this and that. Yeah. Well, give me all you got and don't hold it back. Because I'm happy.
And welcome back to the Tom Marino Show. I am your host, Mindset and Success Strategy Coach Tom Marino. Thank you again for tuning back in. We've been having a great conversation here this afternoon with my 2 friends from Wellbridge Addiction Treatment and Research Center in Calverton, Aynisa Leonardo and Stephanie Morgan, who are in the business development, part of the business development team there. And, right before the break, we were talking about a couple of things, and we had talked about family and the importance of having good support systems and having that structure in place. And Stephanie, during the break, you mentioned that sometimes people don't want their families involved. So how do we navigate that when somebody doesn't want to include their family in their support?
Right. And I think Aynisa did touch on it a little bit. Of course, family can look different for everybody, but as you were talking about the holidays upcoming, I think we all know that sometimes family can be a part of the problem. And
really?
Of course, we're going to help you. The dynamics are different for everybody, but everybody's treatment path is different. And I just wanted to emphasize that you may replace that with a one-on-one therapy session. It's not mandatory for everybody to have their family involved.
Right. The key is deciding what is the right support system for each person, right? So that it may be family in some instances, it may be the therapist and a coach and other people on the outside that may be part of that. It may be, do you guys encourage people to go to AA and to go to different groups? How do you handle like that post-care continuation around their treatment plan? Do you encourage groups like that? Because peer groups, as we know for trauma, peer groups are so essential to helping people heal and continue their journey.
It's such a cliche phrase, but we do meet them where they're at, right? We meet everyone where they're at. So if someone is completely opposed to a peer recovery group, we're like, okay, let's find an alternative. But we do present it as an option and we do suggest it. Historically, it's been very successful. And many people will try it while they're in treatment with us and love it and walk away with friends and peers that they really get a lot from. So we do build it into the discharge plans. We actually have a wonderful discharge planner named Melissa Murphy. I'm going to give her a shout out. And she helps with the aftercare plans, and she really looks at all of those dimensions.
That's awesome.
Yeah.
That's fantastic. So, what new programs do you have? I know we were talking about a couple of things during the break. What's going on there that we should be excited about for 2023 specifically?
We're always building.
Yep.
Yeah. And the patient needs, I think, across healthcare, but specifically with mental health and addiction, are always evolving.
Right.
Because we as communities and as people, our needs change over time when technology changes and work-life balance changes and the pandemic. And I mean, the list goes on and on. Right. Needs change. So we try to evolve with the times. One thing that we're really building right now is our wellness services. So we always had them, but recently we have a rec therapist and a wellness coordinator who are amazing, who do a really thorough assessment as far as wellness needs. So they do something called I told Stephanie on the break, what is it called?
Leisure barrier.
They do an assessment of what people need for wellness, and then they assess the barriers. They call them leisure barriers.
Right.
Wow.
Which is such a cool phrase, right? We all have them.
Yeah. Well,
learn something new every day.
Does it mean the barrier to me having fun?
Yes, exactly.
That it?
Yes.
That's awesome.
Yeah, or taking care of yourself. Or like every night I want to go for a jog, but I'm too tired because my job is too stressful, right? That's a barrier to what you need.
Yeah. See, I would call that obstacle. I would call that like what's getting in the way of you taking your self-care time.
Yep.
But I love that. Maybe I'll incorporate that into my practice. What leisure barriers do you have? Oh, that's an interesting.
What we're finding is people have so many.
Yeah.
And it's part of, I think, what drives the problem.
Right. Well, I mean, listen, we're parents. The three of us are parents. We're running everywhere for our kids, doing everything for our kids. That's a leisure barrier. My kids are a leisure barrier to me getting out and doing stuff that I want to do for myself, with me and my wife, and go out and but that is such a thing that we don't see it necessarily as that, but that's what a cool label.
Yeah.
Like it's a leisure, it's a leisure barrier.
And a lot of people might just think, oh, this is life. This is life. There are skills and techniques to overcome the stress that comes along with those. And this is what I love about Wellbridge. I feel like this is what sets us apart. Where you mentioned everything is evolving. We are evolving with it. And I feel like it's in real time. And I love that about this organization.
Well, and you said something, Aynisa, very clear about meeting the clients where they're at, meeting the patients where they're at, right? So you know that I work in healthcare and I work for an organization in Harlem and we do harm reduction. And that's the model of harm reduction, is meeting the client where they are. Because if you can meet the clients where they are, you have a better opportunity for success with that person than just trying to tell them you got to do this all cold turkey. There's meeting the client and really figuring out what that person needs. It's so individual. How does that work? Is the goal sobriety? Is the goal harm reduction, right? Oasis has finally adapted this whole concept of harm reduction, and they finally on board with that it's not just full sobriety. So what do you advocate for at Wellbridge specifically in meeting the client where they are?
So there's a difference between somebody who's leaving and says, you know what, I stopped using pain medications, but I'm going to drink every day. We're not going to align with that goal. Right.
Right.
Doesn't sound healthy. Doesn't sound like something that will help them in their recovery journey. Somebody who is on different medications that are managing anxiety, or they're on MAT, which is medication assisted therapy, and it's structured and it is aligned with something that they actually emotionally need, we'll support that, right? Because there's multiple pathways to it. I would love to say that abstinence is the answer for everyone. I know that it is not. Right. And we have to understand that. We have to meet them there because it's the reality that we live in, and we're all completely different people. And if we were too black and white about it, we would lose people. And then the risk is them developing really serious mental health challenges, or developing a really strong habit that could lead them to overdose, or 20 years of alcohol use and then a chronic health condition, right? So we look at it like, what's the better of the evils here, and where can we do it in a way that's safe and structured?
See, that is the key. It's what is the safest structured approach for people to do that, right? How can they do this safely? How can they use safely? How can they do, and if sobriety is not the option for them, and that's such a powerful thing, is providing this, and that's what harm reduction does, right? Is make it safer, make it safer for you to use. Like we have syringe exchange programs and things like that, to especially for people who are using needles, to have a safer way of using it. They just
came this week to visit us, actually.
That's fantastic.
Yep. And Narcan kits we send home with everyone, and there's controversial thoughts about that as well.
Yeah, there's a lot around that, but you know what? I've seen our people in Harlem save so many people on the street with Narcan, and it's one of those things. This is the reality of the world that we're living in, and if somebody is struggling with their choices, we should be saving them if we can. And that's what we're here to do, and here to help people do. Let me ask you this question. Working in the field that we work in, it's not easy. It's a tough field to work in. So how do you leave it at Wellbridge and go home?
Yeah, it's a great question.
This is actually an interesting question. I studied to be a social worker in college, and I ran from this field because at that time, first of all, I probably needed therapy myself. I wouldn't have made a good therapist, but it was so hard to see folks in crisis and in need, and all this red tape that existed to help them, and the difficult system to navigate, that it frightened me. And I felt, I couldn't do this as a career. And now I feel like, especially having worked at Wellbridge, it's really helped me see that addiction is a treatable disease, and people need help. And if you can say at the end of the day, you spent, 8 hours giving your all to help as many people as you could, you can go home at the end of the day and feel like you did the right thing, and that tomorrow's a new day and a fresh start.
That's awesome. That's beautiful. And you're right. It's the time that we put in, making the time count, right? You mentioned before how Wellbridge is intentional. And I talk about in the adrenalized life, right? What do I mean by that? Well, one of the things is committing to the intention. And you just committed to the intention. And that's something that people struggle with work-life harmony, because I don't believe in work-life balance. I'm a work-life harmony guy, but it's about being intentional, and being intentional what you're doing with that time that you are there allows you to leave and go home and do what you need to do. Aynisa, we're going to ask you after the commercial break what you do. But if you're just tuning in, we're speaking with Aynisa Leonardo and Stephanie Morgan from Wellbridge Addiction Treatment and Research Center from Calverton. You can visit them at wellbridge.org. And if you have any questions for them, we'll be here for another few minutes. Give us a call at 631-451-1039. That's 631-451-1039. We'll talk to you right after this break. And welcome back to the Tom Marino Show. I'm your host, Mindset and Success Strategy Coach Tom Marino. Thank you for tuning back in on this beautiful Thursday afternoon, October the 20th, 2022. We are wrapping up this year, people. Get those last minute goals in for the year. Start thinking about what you want to do in 2023. It's a great time as we transition to fall to start thinking about what those transitions are for you in the coming year. And remember, I always see transition as the opportunity to evaluate your self-care, right? And we were just talking about that with Stephanie in the last segment, about being intentional about leaving work at work and being intentional with how you spend that time. We've been talking with Aynisa, Leonardo, and Stephanie Morgan from Wellbridge Treatment and Addiction Treatment and Research in Calverton. And I believe we have a caller on the air, ladies, from Sayville. So Jim from Sayville, welcome to the show.
Hi, Jim.
Yes, good afternoon. Good afternoon. I'm driving and listen to your program quite frequently, and it's not the first time that I've heard representatives come from Wellbridge, and it sounds like a beautiful, beautiful place. However, you, Mike, you're up in Harlem, I think you said, or the Bronx.
Yes, I'm in Harlem, but Wellbridge is in Calverton, out on the East End.
Yes, I'm aware of that. I'm just wondering, it sounds like a beautiful place, and my daughter is an alcoholic and has been in and out of facilities for years, and she's currently away at a 7-month program upstate New York. But I'm always concerned about everything, revolves around insurance. And I'm wondering if Wellbridge is a facility that takes people, say, that doesn't have a policy on the outside, that they might have SSD and Medicaid. Do you take patients with that insurance?
So we take 7 insurance carriers. Medicaid is not one of them. We do scholarships for cases that have Medicaid, and we offer, don't quote me on this, but probably 15 to 20 a year. Probably a little more than we should, but we do try to meet everyone where they're at. The other thing is we have a call center that is committed to providing an option. If we can't take the insurance, we provide them with at least one phone number, usually 2 or 3, so they could find the right facility. Because you're right. I mean, if somebody's making that phone call, you want to make sure they get something out of it, whether they're coming to our facility or going somewhere else. But we really do try to connect them and not just say, I'm sorry, we don't take your insurance. That's not the answer we want to give.
Well, I appreciate that. My daughter's been in and out of Seafield numerous times, as well as South Oaks and et cetera, et cetera. So I'm well aware of the fact with the insurance issues. You can't always get a good therapist when you're on that insurance. You can't always get a psychiatrist with that insurance. So it is a round robin situation,
Yeah.
So I'm sure you hear that probably quite frequently.
We do.
For sure. And Jim, one of the things that I know my team, Aynisa and I, were committed to is continuously building resources and networks so that when we do get calls like yours or, from your daughter, we can provide those resources to you and a contact name, and just make sure that you're not being turned away with, nowhere to go. So that is one of our commitments.
Well, Jim, thank you for giving us a call. Was there something else?
I just wanted to know what would be the phone number to contact you.
Yeah, so it's 631-840-6758. 631-840-6758. That's the main number. But if you ask for either one of us, they'll send us the message, Jim.
Stephanie?
Stephanie, it's the same number. It's the main number, but you can ask for either one of us through that number.
Okay. Well, thank you so very much. It's nice to hear that you guys really care. I think I'm going to visit that place because it sounds beautiful and everything.
I love that.
Yeah.
Thank you, Jim. And we wish you the best of luck and your daughter as well.
Thank you, Jim, for calling in.
Thank you very much. Thank you.
All right. Have a good one. Wow. I mean, that is a classic conversation that we have in healthcare all the time.
That's right.
How do we get this stuff covered? I am so impressed that you offer scholarships for people who don't have the means, so to say, to really support their rehab.
Yeah, we do. And I mean it when I say, like, if you call right now and you don't have insurance, you have Medicaid, you have a commercial plan that we don't take, you will never get an answer that doesn't give you something that you're walking away with, an option, a solution, something that feels like it's still proactive, because we want to capture that motivation that people are calling with and just follow through with it instead of just saying no. It might have taken that person 8 months to make that phone call, and we totally understand that.
Yeah. And that we don't want more barriers to care. We constantly come when someone is ready, right? You talked about before this person who's stuck, right? When you have somebody that's ready, you cannot give any barriers. You cannot have any barriers to people getting what they need at that time.
Yep.
That's huge.
Yeah.
I know your listeners can't see, but that's why I put the 8 hours in quotes earlier, because it doesn't stop. And, we truly care. Our cell phones will ring many hours of the day or night, and we want to be there to catch that small, narrow window.
Absolutely, because that is the window of opportunity. That is the window of the greatest change that's going to happen for that person. And we don't need these barriers. So, Aynisa, before the break, we were talking about how Stephanie, I asked the question about, how do you take care of yourself, really, and not take it home with you, and especially working in such a tough environment like we work.
Yeah, so it's very similar to Stephanie's answer, and I promise I'm not cheating off of her. But I always give a similar answer to this. As long as we know that we did everything we could, then you can walk away with a sense of peace. If I feel like we missed something, then that's what eats me away at night, and I can't sleep.
She doesn't stop.
Yeah. But most of the time I don't stop because I'm getting a call or there's a crisis. I'm fine with that.
Right.
But if I feel like there's something more we could have done, I'm not okay with that. So at Wellbridge, we want it to be bulletproof. We want admissions to be solid. We want the clinical care to be solid. So we know we're doing every single thing that we can to help that person. Might they still relapse? Might they walk out on day 3? Yeah, those things happen. But if we know, I always say, and I say it to other teams and staff, we did everything we could with this. That helps you to go home and be okay with that idea that, yes, this happened, but it's part of the disease.
Right. And that's a key point, right? I remember when I was working, my first job out of PA school when I became a PA was on a geriatric psych unit. And I remember having a client that she came in for depression. She was catatonically depressed. We did ECG on her. We got her treated. She came back to life. But she had come in with suicidal ideation. That was the reason. And when we went to discharge her, the psychiatrist said, I don't want to discharge her, but we have no choice. We can't keep her here. There's no reason clinically to keep her here anymore. Unfortunately, 3 months later, she was successful committing suicide with an aide right next to her. At the end of the day, there's choices, and there's overwhelm, and there's stress, and if we put our best effort forward, we could only hope that somebody makes a good choice for them and continue. And that's what we have to hold on to, I think, is remembering that we can only do so much in what we do, but everybody has the freedom of choice. So, and that really brings us to the most important thing is to make good choices, to keep doing what we're doing, to help people to make better choices, to give them the skills that they need. This has been so much fun. We're out of time.
Oh my gosh.
But what else is new when we sit down and talk? But, thank you both so much for being here today. I really appreciate it. And please check out wellbridge.org. Is there anything else, Aynisa, that we should say, or Stephanie, before we close out?
We just really appreciate the conversation with a like-minded professional and all the work that you do, empowering communities and health and wellness. And what did you call it? Not a work-life balance, work-life harmony. Yeah, we appreciate it. Thanks for having us.
Thank you so much, Tom. And look for Tom on our show soon to come.
Yes. We'll do another show swap.
Yes.
All right. So that's the Tom Marino Show for today. I want to thank you all for tuning in. Listen, if you are a solopreneur, an entrepreneur, a business owner, and you're struggling, you're stuck, you're stagnant, and you want to make decisions and move to action, give me a call, 516-588-0750. That's 516-588-0750. You can text me, call me at that number, or just visit my website at tommarino.com. That's tommarino.com. And let's get you on your journey to making powerful change in your life and getting back on track. All right, until next time, this is Tom Marino saying, choose your adrenalized life.
I'll be just fine. No offense to you.